nutrition, for individual health, and for planetary health. We're going to highlight how food fits into our current global crises. We'll highlight the benefits of plant-based diets for individual health. We'll review some of the impacts of our food system on the environment. And if we have time, we'll talk about some tips to incorporate more plant foods into our diet. So why does food matter? I would say that there is no human activity that has a broader and deeper impact on the planet than our food system. It is the central driver of our interconnected crises, of rising chronic disease, unsustainable health systems, ecological breakdown, and climate breakdown. The Eat Lancet Commission says that food is the strongest single lever to optimize human health and the environment and sustainability. Chronic diseases are crippling our communities and our health systems. 73% of Canadians aged 65 and above have at least one of 10 common chronic conditions. And that's important because our top cause of death globally is chronic disease or non-communicable diseases. 75% or more of death is due to at least 4 top causes: cardiovascular disease, cancer, which is the top cause of death in Canada, respiratory diseases, and diabetes. And these top 4 account for 80% of our premature deaths from non-communicable diseases, meaning under the age of 70. We live our last 1 to 2 decades in ill health, and we don't need to. So what are the risk factors for developing chronic disease? Well, it turns out that diet is the top risk factor for chronic disease. The Global Burden of Disease study tells us that suboptimal diet is responsible for more deaths globally than even tobacco. So I noticed on our way in, you're not allowed to smoke within 25 meters of the entrance. But we don't say anything about what we eat. If we improved our diet, we could save 11 million deaths per year. We could save 1 in 5 deaths per year. And our top diet-related diseases are cardiovascular disease and cancer, which are our top 2 causes of death in Canada. So what are our dietary risks? They are eating too much sodium, which is probably a reflection of our processed food intake, and not enough of the plant foods, not enough fruits, vegetables, whole grains, nuts and seeds. So how are the Canadians doing? You don't have to read that graph. I will tell you that 23%, only 23% of Canadians are eating 5 fruits and vegetables a day. And we are eating double the amount of red meat and dairy than is recommended. And it is estimated by the Lancet Commission on Climate and Health that about 14,000 deaths occur each year due to too much dairy, too much meat, and that does not need to happen. Now, before I go into a bit more detail about the benefits of plant-based diet, I'm going to talk about what is the definition of a plant-based diet. Because when you say plant-based diets to people, it means different things. And it's not surprising that there is confusion because actually there is no strict definition of what a plant-based diet is. But we can say that a plant-based diet is one that is centered around whole plant foods, fruits and vegetables, whole grains, beans and other legumes, nuts and seeds, and herbs and spices. By definition, a plant-based diet does not have to mean 100%. It just means, if you look at the literature, it's about 85% from plant foods and less than 15% from animal foods. So it can be a variety of diet patterns. It could be vegan, vegetarian. It could be Mediterranean, flexitarian, pescatarian.
Excuse me, just clarification on the percentage. Is that by calorie intake total?
It really depends.
Or is it
there is no
mass,
strict
grams?
There is no strict definition.
Okay.
But it can be calories or it can be the volume on your plate. Depends which source you're looking at.
Thank you.
Great question. So what are the benefits of a plant-based diet? Well, a plant-based diet is low in calories, yet high in nutrients. So that's great for helping us maintain an ideal body weight. Unfortunately, 60% of Canadians are either overweight or obese, and that is a risk factor for our chronic diseases. The diet is low in saturated fat, the bad fat, so it helps us maintain good lipid levels, good cholesterol levels, so that reduces our risk of conditions such as stroke and heart disease. It's high in fibre, it helps us with satiety, it improves our gut health, our microbiome, it improves insulin sensitivity, it's high in antioxidants and phytonutrients, so it lowers inflammation in our bodies, it's low in sugar, and it can support health at all ages, all stages of life. We have literally decades of evidence which link plant-based diet to lower risk of chronic disease. It is associated with a 25% lower risk of coronary heart disease, 34% reduced risk of diabetes, reduced cancer risk. I spend my days talking to my patients about including more plant foods in their diet to reduce their risk of cancer, but also to improve their outcomes after a diagnosis. It reduces risk of stroke and kidney failure, fatty liver disease, Parkinson's disease, dementia, sleep apnea, COVID, and all-cause mortality. And the good news is that it's in our international and national consensus and guidelines. Plant-based diets are endorsed for prevention of disease, but also in first-line management of many of our chronic diseases, including our cancer guidelines, our heart guidelines, our diabetes guidelines, by the American Medical Association, by the American College of Lifestyle Medicine, by the World Health Organization, and I could go on. And of course by our wonderful Canada Food Guide. And as many of you will know in this room,
We lost your picture. Anybody want to move up? There's a seat up here. Two of them.
I did it.
Way to go, Andy.
so here's our Canada Food Guide. This was updated in 2019, and you will remember that the Health Minister in Health Canada decided not to allow lobbying when they were updating the guide, which means that there were no vested interests, no animal agriculture was able to influence the guidelines. Which means that it's a really evidence-based plate, and it turns out it's a plant-based plate. Half the plate is fruits and vegetables, a quarter is whole grains, and a quarter is protein. And the guide specifically says, choose plant proteins more often and every day. So that to me means it's an 87.5% plate of food. So to your question, this looks like it's more volume, but when we talk about the Eat Lancet Commission, it's actually calories. And we have data now that if you follow the Canada Food Guide, you will reduce your risk of heart disease. Now, if you should choose to be 100%, I'm 100% plant-based, and I know some of my colleagues in the audience are as well, we can be reassured that the major dietetic associations do say that a plant-based diet, vegan and vegetarian diet, appropriately planned, can be nutritionally adequate at all stages of life, and can offer long-term health benefits. Here is the position statement from the largest dietetic organisation globally, the Academy of Nutrition and Dietetics, which states the same thing. So now moving to the impact of our food system on the planet. We have breached 7 of the 9 planetary boundaries. The planetary boundaries are the limits within we need to operate to ensure stability of our Earth systems so that it is sustainable for our survival. And we have reached 7 of them. And of those 7, 5 of them have the food system as the largest contributor to their transgression. So climate change, biosphere integrity, which reflects biodiversity, land system change, freshwater change, and biogeochemical flows. Our food system globally is responsible for 1/3 of all greenhouse gas emissions. This is hardly mentioned in climate discussions. There was a study a couple of years ago that showed in all the news articles only 7% mentioned animal agriculture. 60% of these greenhouse gases come from animal agriculture at least. If we look at methane, one of the more potent greenhouse gases, methane is 80 times more warming than carbon dioxide. And it has a shorter lifespan in the atmosphere of about 12 years. So this means this is such a great lever for us to address, to slow down the warming of our planet. We see advocacy in reducing methane emissions. We have a healthcare organisation doing that at the moment. Not a mention of animal agriculture, the top cause of methane emissions. but it's estimated that methane is caused up to 40% of our warming. The data says that unless we address our food system, we will not be able to meet the targets of 1.5 or even 2 degrees above pre-industrialized levels. So we do have to move food to the top of the discussion. When we look at which foods create the most greenhouse gases, we see that it's the animal foods. If you look at the top one, that's beef, exponentially bigger than anything else. The next is lamb and mutton, the next is beef from dairy herds, and then everything at the bottom is plant foods. Only a maximum of about 10% of greenhouse gases come from the transport of the foods. You could fly a kilogram of soy around the world 3 times, and it would still be less carbon dioxide equivalent compared to your beef made round the corner. In Canada, it's estimated that the consumption of red meat and dairy totals 69% of the country's total consumption-based emissions. So again, we have a great lever to use here. But it's not only greenhouse gas emissions. Animal agriculture is the leading cause of biodiversity loss and species extinction. We are in the 6th mass extinction, the only human-caused mass extermination of animals on the planet. It is the leading cause of land use change and deforestation and habitat destruction. It is the leading cause of deforestation of the Amazon, the lungs of our planet. It is a leading cause of freshwater use and pollution and antibiotic resistance and pandemic risk. Does anyone know the percentage of antibiotics sold in Canada that are used for the animal agriculture industry?
70, 80, 80, 90.
82%.
82. Oh, me too.
We can make an educated guess that maybe antibiotic resistance is caused a little bit by that.
Yeah, a little bit.
And unfortunately, antibiotic resistance is a real problem. It has been defined by the World Health Organization as one of the top 10 global threats to humanity. Thousands of Canadians die per year of antibiotic resistance. I see it in my practice, and we could do much better.
Can I just ask a question about that?
Yeah.
So you're talking globally, that makes sense. On an individual level, if I don't eat meat,
Yes.
then am I reducing my insulin resistance, my antibiotic resistance? So if I was ill, it's likely that I have a better chance of.
I don't know that that's true, actually,
I was
because
just extrapolating it down to
Yeah.
an individual level. So.
I think that's one of the things that may not be beneficial. Yeah, but yeah, sorry, go ahead.
Yeah, when you mentioned animal agriculture, you're talking a lot about it. You don't differentiate between animal agriculture done in, the confined animal
Yeah.
situation as opposed to the natural grazing or the where they move the animals around
Yes.
into the healthier environment and so
Yes.
on. There's a significant difference on the environmental impact.
So, unfortunately, I didn't have time to go into that, but
Yeah.
that's such a great question. And there's data this year that has come out that has shown that grazing with animals in that way, that regenerative farming, which again has no strict definition, reduces biodiversity. It needs more land, and we know that land use change is one of the single largest drivers of climate change. I can share some references with
Yeah,
you.
please, I'm very skeptical of that.
Sure.
Okay.
Nicholas Carter is an environmental scientist. He is in Nova Scotia, and he's just produced a report a couple of weeks ago on this subject, the myth of regenerative farming.
I'd like to look at that.
I'm happy to send it to you, yeah.
Look at some Korean accent.
I would love to, thank you so much. So what we eat really matters. So these graphs show high meat, low meat, pescatarian, vegetarian, and vegan diets. If you look at the first one, it shows you that a high meat diet emits 4 times as much greenhouse gas emissions as a vegan diet. The second one here, twice as much water is used for a high meat diet compared to a vegan diet. And down at the bottom, 4 times as much land is used. If we think about how much land is used for growing food, it's about 50% of all habitable land. About 80% of that is for animal agriculture, which provides only 18% of the calories. It's incredibly inefficient. So we've talked about plant-based diets for individual health, we've talked about the impacts on the planet. So how can we define the diet that is optimal for both, that balances both? It turns out it's the same, and the work has been done by the Eat Lancet Commission, which I think is the most important food system work that's been done. It was originally published in 2019, it's been updated with even more research in October this year, and they say that animal foods are optional, but if you choose to eat animal products, it should be no more than about 12 to 13% of your calories. And here's the plate. You can see half the plate is fruits and vegetables. We've got whole grains, we've got nuts, we've got legumes, we've got some sugar here, some oils. This bit here, this is the only animal products here. And that would translate into per week not more than 1 portion of red meat, 2 portions of poultry, 2 portions of fish. I don't know about 10 billion people. This is meant to be theoretically for 10 billion people population in 2050. But I think if we all ate 2 portions of fish a week, I think the oceans will collapse and will collapse. So I disagree with that part of it. 2 eggs and you can have some dairy every day. And if you eat this way, you can save 15 million lives a year. And the data also, the more you adhere to this Planetary Health diet, you will use 42% less antibiotics, you will use less fertilizer, you will need less land by about 30%, and you will emit about 30% less greenhouse gas emissions at least. Marta, do I have time to go into some tips? 1 minute. Oh yes. So if we want to include more plants into our diets, I generally recommend that people do that gradually, because it tends to be more sustainable if you choose the bits you want to do and you think you can do. So we want to try and choose more foods from the plant realm. So fruits, vegetables, whole grains, beans, lentils, chickpeas, nuts and seeds, and lots of herbs and spices. Use the Canada Food Guide for helpful visuals, and aim to keep your animal foods not more than 12 to 15% of your diet. I would say minimize or avoid red meat and processed meat. That's what I tell my patients every day, because these are carcinogenic, they cause cancer. Start gradually, as I said. Veganuary Canada is coming up around the corner. You can sign up. They will send you daily emails and recipes and tips for you. It's very helpful to have those.
What was that, Jen? Sorry.
Veganuary Canada.
Oh, I wasn't looking, I was looking.
Veganuary 2020.
Yeah. So it started in the UK and it's really helped people to increase their plant foods. So I generally say, think about doing some of these. Just pick what you like and start. So add 1 extra serving of vegetables to your meals every day. We actually want to aim for 10 fruits and vegetables per day, ideally. Swap dairy milk for fortified plant-based milk, so it doesn't have to be everything, but maybe some in your cereal, maybe you don't like it in your tea. Choose beans, lentils, and plant-based meat alternatives. Don't be afraid of plant-based meat alternatives. Instead of meat once or twice a week, you can then gradually increase, or you can do half and half. So if you've got your bolognese, you can do half lentils, half meat. Try a plant-based breakfast. You can get excited that you started your day off well. Experiment with new whole grains. Keep nuts and fruits handy for your snacks, and add herbs and spices to everything. That's a really easy way to increase your goodness in your diet. And think about having a smoothie every day as well. That's a really good way of just really quickly increasing your good foods. We have a great plant-based starter guide. You can go to our website and download it. Here's the QR code if anyone wants to take a look at their picture. That's okay if not. So in summary, our animal-based food system, I hope I've shown you, is a central thread affecting our individual health and the planetary health. One of the most powerful levers we have for change is on our plate. And I think that transitioning to a plant-based diet is the most important action we can take as an individual for our own health and for that of the planet. Thank you.